Good afternoon and welcome to today's Veterans Town Hall. First of all, I would like to share some information about our main hospital, including commonly requested phone numbers on your screen. So as it will be coming up, yes, on the screen you can see how the numbers that you can utilize to schedule an appointment, contact your mental health provider. Also, if you have questions about My Healthy Vet, or if you have concerns you would like to share with our patient advocate team, or if you have some concerns related to your medical records. And lastly, if you have any friends or relatives that's interested in becoming enrolled into our VA system, we also have our eligibility and enrollment number listed as well. So please utilize those numbers as you deem appropriate. All right, so today's Veterans Town Hall also highlights our Kankakee CBOC, which is located in Bourbonnais, Illinois. Currently, they serve about 85 to 100 veterans on a daily basis. The clinic offers primary care, telehealth, vascular clinic, home-based primary care, audiology, physical therapy, and much more. Veterans in need are also encouraged to stop by the Kankakee's free micro-food pantry, which is open year-round during regular business hours. You'll find the Kankakee CBOC contact information on the screen. If you have any specific questions, please comment below or send us a Facebook message and we will be sure to get back to you ASAP. All right, so updates regarding our Hines VA masking policy. Updates have recently been made, so starting effective April 1st, 2026, masking is now optional in non-clinical areas and outpatient waiting areas across campus. However, to prioritize the safety of our patients, masking will still be required in high-risk departments, including dialysis, ICU, CLC, chemotherapy, and RCF. Additionally, we have a blood drive coming up on April 20th. We invite all visitors and patients of Hines to donate blood at our next blood drive. Once again, it's April 20th during the hours of 9:30 to 1:45 p.m. and it will be located in our auditorium in Building 9. That's located on our main campus, so we hope to see you there. At this time, I would like to move on to our safety story that will be shared by Ms. Natalie Pettigrew.
Hello, my name is Natalie Pettigrew, and I will be presenting our safety story today. Our safety story today highlights a proactive and coordinated approach by the VA home-based primary care team, particularly the social work, address the veteran's severe dental pain and related health decline through timely and compassionate intervention. The veteran is enrolled in home-based primary care. The veteran had mild cognitive decline, is low income, and home alone during most of the day. He was having extreme tooth pain to the point it was causing the veteran to eat less and lose weight, which was becoming a health concern. The veteran did not have dental services covered by the VA and could not afford dental services. The social worker reviewed local resources and connected the veteran with the local agency called Veteran Smile. They were able to do the necessary extractions and even fit the veteran with partial dentures. The social worker also connected the veteran with home health aides to assist with meal preparations and reminders to eat. VA dietitians provided liquid supplements. By adopting an HRO approach, every staff member, particularly the social worker, acted as a proactive problem solver. They identified the veteran's deteriorating health due to dental pain and took preemptive steps to address this risk before it escalated into a more serious health issue. This preoccupation with failure and anticipation of risk helped prevent further decline in the veteran's health. The veteran no longer has mouth pain and has consistent caregiver support in the home and is now stable and at a healthy weight. This concludes my safety story. Next up, we will have the Chief of Staff Medical Updates by Dr. Michael Richardson.
Thank you, Ms. Pettigrew, and thank you for that story. For the medical update this day, I'm going to start by reminding you again for what the acting director had spoken about, which is our change in our masking and our visitation guidelines. As she said, we are back to normal with masking only for the high-risk areas, which she outlined: dialysis, ICU, CLC, chemotherapy areas. And if there is an outbreak, obviously, then we would be masking, but that would be shown and that would be, the notification would be placed outside the unit. Individual requests for masking by either the patient or the staff, certainly we try to honor that because there may be a reason why a patient or a staff member wishes to be masked, and that can be done. And I remind you for our visitation again is allowed, but children under the age of 12 are not allowed in our units at the moment. Waiting areas, perfectly fine. Moving on to the second thing is our immunization. Our flu and COVID vaccinations and immunizations are still available, although we are a little past the height of the flu season. You still can, by speaking to your clinic nurse, get a flu immunization if you wish. And of course, COVID vaccinations is available, again, speaking to your primary care providers about that. Third issue to update you is the expansion that we have this year and continuing in our virtual and connected care modalities that we use. We have seen over the years our VVC, our CVT, and we have expanded our telehealth so that we are being more robust about being able to monitor a veteran who needs that monitoring with a home daily or weekly telehealth visit from our telehealth nurses. There are a number of ways in which you can sign up for this. As you know, the VA has moved on and we have now Annie, we have now the ID.me way of signing up. We have our health messaging or secure messaging which can be done. And all of these areas are so that veterans can have an ability to speak with their provider or to speak with a member of the team without having to drive, come into the campus and wait to the campus. So I encourage you to look into these areas, speak to your provider, speak to your nurse or your social worker if you are interested. We have a lot of ways in which we can help you to dial up and to be connected. So if you are not completely au fait with the internet or with your smartphone and usage, we certainly can manage and help you in that and make sure that connection works for you. Last thing I want to update is our ongoing movement to change from our CPRS to a federal electronic health record. I'm sure everyone has heard about this. All go live for our Hines and Jesse Brown and Danville is in March 2027. At the moment, this week actually, Vision 10 in Michigan, Ann Arbor, Battle Creek are going live. But this is a 18-month process of making sure that we transfer records, etc. What it will mean for veterans, however, here at Hines, is that we have begun to look at the clinic schedules, primary care clinics, specialty care clinics, and see whether or not we are going to be able to manage and how we are going to be able to manage while for this next year we train all the staff on the new on the new electronic record, and also we begin to move the records from the current CPRS into the new FHR. The veteran, you will not notice any difference. Your records will be intact, but it may take a little longer sometimes for your provider to access all your records because as they transfer across, some of that is going to take a shorter time. Additionally, and you will hear some more from our pharmacists, there is going to be differences in terms of the medication management that we do in CPRS. But that is something that we'll have a long time to talk about. This is beginning in August, but you will hear and you can speak to your providers or your nurse about that transition and about the schedules for clinics. So those are the only things I have to talk, and thank you again. And I'm going to ask Dr. Ashley Scales to come and speak to us about our canteen.
So good afternoon. On March 27th, we have shut down our canteen for construction updates that will last about 6 months, maybe go over a little over 6 months. But we wanted to ensure that veterans still had access to food and beverage options. So we do have grab and go available at this time. The store will remain open and fully operational. For hot food, we don't have that right now, but we are working with local leadership, regional and national Canteen leadership to see if we can partner with vendors and food trucks to come as the weather changes over here slightly. So we do ask for your patience and understanding during this time, and we hope to see you in the Canteen during our downtime. Thank you. I will now turn it over to Dr. Elizabeth Stone for medication updates.
Thank you and good afternoon. I hope everybody is doing well. My name is Elizabeth Stone. I'm the Chief of Pharmacy here. It's my honor to be speaking with all of you today, and thank you so very much for your service. As we heard, we are transitioning to a new federal electronic health record, and today I'll be speaking about one of the required preparation steps to ensure that we are successful in this transition, with our go live being March 20th of 2027. Specifically, I will be talking about the transition from half tablets to whole tablets. So a little bit of background is that previously the VHA implemented tablet splitting as a cost savings measure. However, the new FEHR requires that any tablet strength that's commercially available as a whole tablet be dispensed as that whole tablet and not a half tablet. When does this need to happen? The conversion needs to be completed prior to our go-live date, which is March 20th of 2027. So what has been done and what is being done is that veteran patient letters to bring awareness of this education and change were mailed out on February 23rd of this year. They're also placed in our counseling booth of our outpatient pharmacy for distribution and handed out to veterans on discharge. Hines clinical staff and the patient advocates were notified of this change and to continually educate and or remind veterans and any clinical encounter about this information in the patient letter. And then starting in April this month, pharmacy will begin the conversion of existing veteran prescriptions from half tablets to full tablets. This will be an ongoing rolling process. Please do note that on the prescription label, any converted prescriptions will state review new dosing instructions converted to full tablet. It's also important to note that our current ordering screens in our current electronic health record system have already been updated to full tablets for any new prescriptions. So what can we all do to help support this to be successful? Bring awareness and education to any fellow veterans of this change. And as always, with any prescription, please always read the label and instructions carefully on any new prescription or refill prior to taking any medication. As always, any questions or concerns about any medications or prescriptions, veterans can always call the pharmacy at 708-202-2375. Thank you. Now we'll be hearing a whole health opportunities for veterans by Mr. Anthony Muro.
Thank you. Hello, my name is Anthony Muro. I am a whole health partner, and I'm here to talk about whole health. Whole health is an approach to healthcare that puts you in control of your care. Focuses on self-care, skill building, and support. Take a few seconds and think about what it might look like if we actively engage in our healthcare. Whole health centers around what matters to you, not what is the matter with you. This means that your healthcare team will get to know you as a person before working with you to develop a personalized health plan based on your values, needs, and goals. Whole Health Month 2026 invites veterans to explore how evidence-based practices support a more personalized, meaningful approach to care. The Veteran Whole Health and Patient Experience Fair, held on April 29th from 10 a.m. to 1 p.m. in the auditorium, will highlight services, research, and programs that place the focus on what matters most to veterans and how we come together to shape high-quality, compassionate care. Attendees will have the opportunity to engage with services across our facility, grab a snack and coffee, whole health items, and learn how the engaging in whole health enhances health outcomes. And then just 3 weeks after the Whole Health Fair, please come and join us for our 16th annual VA2K Walk and Roll. The VA2 Walk and Roll will take place on May 20th between 10 a.m. and 2 p.m. in the Winter Garden and also the Seabox to raise awareness of VA homeless veteran services and to promote healthy, active lifestyles. There are donation bins in the lobbies of Building 200 and 228 with a list of suggested donation items. There's also a donation bin in Building 1 just outside of the Patriot Store entrance. You can also scan the QR code on our VA2K flyer. We invite you to our walk and roll for health and support of our homeless veterans. For more information, please reach out to us at area code 708-202-2929. Thank you. I hope to see you at our VA2K. Now we have Candice Kemp with patient experience.
All right, everyone. My name is Candice Kent. I'm the Veteran Experience Officer here at Hines VA, and today I'm excited to talk to you about all the amazing things going on at Hines VA to shape your care here. Next slide, please. First, as always, a big thank you for sharing your feedback. Recently, we received our SHIP survey results from the Center for Medicare and Medicaid, and I'm excited to announce that Hines VA received 4 stars for our Hines VA inpatient experience, and we are #1 amongst 37 high complex facilities within BHA, reaffirming that no matter where you go, inpatient or outpatient, you feel seen, heard, and respected. So please keep sharing your feedback. We look forward to hearing from you. Next slide. And next, it's the most wonderful time of the year, Patient Experience Week. This year, we have a lot of events queued up for you all. Monday, we'll be celebrating our veterans, saying thank you on National Day of Thanks, celebrating you all for choosing Hines VA along with the Garrison Needs Foundation. On Tuesday, we'll be highlighting innovation, the impact it's had here at Hines VA regarding your care. Wednesday, as stated, we'll be hosting a health fair in partnership with Whole Health here at Hines VA in the auditorium. And Thursday, we'll be celebrating your feedback, how it has shaped care at the VA and the impact it's had on our services. And Friday, we celebrate our amazing staff, the amazing men and women who show up every day to serve you. So please keep your eyes and ears open, and we continue to highlight the services, highlight the celebration over the next couple of days. We look forward to celebrating with you this year and look forward to you coming out to Hines VA. Next slide. And most importantly, I want to give you all an update about the Veteran Resource Center. As you all know, the Veteran Resource Center was developed to be a one-stop shop for our veterans, providing necessary support and services to you to enhance your care. With that said, we'll be connecting with the Connected Care team along with our patient advocates and the library services within the VRC to provide in-person support regarding a variety of virtual healthcare services to include My Healthy Vet, Annie, and also a variety of imaging and connecting you with telehealth support services. Again, this is being done to improve your care here at Hines VA and to ensure you remain connected to your providers and the care you need. If you have any questions or concerns, please reach out at 708-202-8129 to connect with the Connected Care team. And then next I have Ms. Director Morris with the final remarks.
Candice. So as you can see from today's town hall, we have a variety of different events that's coming up. So please continue to check out our social media platforms, our website, just to ensure that you are aware of what's going on. As we develop more things, we'll happily bring it back to this platform as well. So if you did not know, our next town hall, it will be occurring on June 10th, but once again, you do not have to wait if you have any major questions or concerns. You can always go back to the slide where you can pull any of our numbers there for the relevant topics and reach out to us anytime, and we'll happily follow up with you. Thank you for your service, and thank you for joining us today. See you next month. Bye.